It's your girl Lanice, and I am here with another video for you guys as always. As you can see, my background is a little different because I am in my bedroom. Yes, I have a couch in my bedroom where all the magic, no, just kidding, but this is, you know, my bedroom. I have a couch in my bedroom for reasons that I don't feel like explaining right now, but it's nothing nasty. But anyways, I am here with another video. In today's video, as you can see, I got my spiffy little uniform on because today I will be talking about another nursing topic. So today I wanted to come to you guys and I wanted to give you guys some tips some tips for new nurses from a new nurse. My name is Lanice, if you are not aware of that already, and I have been a nurse. I've been an LPN since 2014. I recently went back to school and got my RN, and I graduated in May of 2020. So I have been a nurse for a total of 6 years now. However, again, as you just heard, I am a new RN, and this is my first time ever working in a hospital setting. And I have learned many things over these last 90 days from a new nurse. I feel like I would share with all those people that will be getting out of school soon and will be a new nurse also. So here we go. Number one tip I'm going to tell you is the most important tip of them all, okay? The most important tip of them all is to empty your pockets at the end of your shift. And let me tell you why. That's the number one thing. If you don't do anything else that I tell you, you want to empty your pockets at the end of the shift, because if not, you will end up going home with medications or MARS, which will violate HIPAA policies if you do not empty your pockets and you take those things home. So taking home a medication is not as bad if it is not a narcotic. No, a narcotic is definitely a termination, definitely a fireable offense, but you just don't want to go home, you know, with any medications from patients, because then that leaves your night shift, or if you're on day shift, if you're on night shift, it leaves your day shift with the task of having to find those medications. So say, for example, some medications are located in the Pyxis, so you only get the amount of pills or cough syrups or whatever's coming out of the Pyxis. You only get the amount that you need for that percentage, or that dosage, excuse me. However, there are some medications that are found in patient bins, i.e. inhalers or medications that aren't normally stocked in your Pyxis. They're put into bins for your patients, and those medications, sometimes they don't just put the dose that you need for your 9 o'clock medication administration. Sometimes they put the medication in there to last the patient the whole entire day. So I have you know, been so quick at pulling my medications in the morning to where I will go and I will get the bag full of medications, not even realizing that it's not just the dose that I need, but it's also the dose that my patient will get on night shifts. And I'm almost positive if I wouldn't have remembered to empty my pockets, night shift would have had a very hard time getting those medications from the pharmacy, because I had a hard time already getting them on day shift when pharmacy is up and going and they're very busy and they're doing nonstop deliveries to the Pyxis and nonstop deliveries for medications. So number one tip is empty your pockets. Don't take any of that stuff home. Please don't take any of that stuff home. Please don't take any of that stuff home, okay? So you guys are so special to me. I whipped out my handy dandy composition book. So my next tip would be, these are tips that I've learned, you guys. Not saying these are all the tips that I follow. However, my next tip, number 2, would be to get to work a little early. Now again, I have to be at work by 6:45 in the morning. In the last couple of weeks, I've been driving an hour away. So getting to work early, like, it's not something that I do. It's something I'm trying to get better at. However, I have noticed that the nurses that come to work, they get there about 30 minutes before their scheduled time. They have time to get organized, and they have time to look up the information on their patients that they'll need for their shift. So a lot of nurses, they'll come in and go ahead and look at their nursing orders, go ahead and look at the labs from today. They'll just come in and get as much information on their patients as they can, So when their night starts or their day starts, they're already ready to go. And a lot of times there's this one girl that I work with. She always comes into work early, gets all her information, color codes everything. Like, I don't know what kind of OCD she has, but she's got to have it. However, she's an amazing nurse. And whenever we're giving off report, there are things that she will ask me. And I'm like, oh, wow, I wasn't aware of that, because I probably didn't get all of the information that I should have gotten while checking charts, because for one, I didn't get to work early and check the chart, and two, once my day gets started, a lot of times it's hard as a new nurse to not only do the tasks that you have to do during the day, but also go in and check all the new orders and all the new labs. And even though I do it, it's a struggle, and I feel like if I were to get to work earlier and had all that information after I got report in the morning, I'd be pretty much ready to go. So tip number 2 was to get to work early. So my next tip is to build a brain, not the one in your head. Nurses know what a brain is. Build a brain that works for you, or just make sure you have a brain that has all the information for the patients that you need. So for example, I actually brought a brain. Let me go grab it real quick. So here is a brain that someone created on their own. Here we go. You can see it better right there. And a brain is just what you use to know everything about your patient, hence the name brain. So I'm just gonna call off what's on this brain. Of course, you have the person, the last name. You have on here, you have the date of admission. I'm so sorry, it's horrible, you can't see it. You have the date of admission, you have their code status, whether a DNR or full code. You have their attending physician, which is the physician you'll contact anytime you have issues with that physician. And what in the consult, so does the patient have any type of surgery today? Do they have any type of PT consult, speech therapy consult, anything that you need to know about during that day or during that shift? Are they on isolation precaution? And precautions that you need to take for this patient. Are they fall risk? Are they droplet precautions, contact precautions, stuff like that. So then you have the med history. And then you have the diagnostic test, and then you have what are they taking, VTE, what are they taking for embolisms? Are they taking any type of blood thinners, Lovenox? Are they taking heparin? What are they taking to prevent any DVTs? IV sites, that's very important. You want to know where your patient's IV sites are. You want to know the status of those IVs. Do you need to change the dressings today? Is the IV looking like it's, you know, does it have phlebitis? Does it look like it may be infiltrating? Is the IV occluded? I actually had that issue the other day. Like, I had a woman, her IV was clearly in the vein. It was not infiltrating. It didn't have any signs of infection. However, it just kind of occluded at the end. It just got a blood clot at the end and it no longer worked. So her IV sites, IVS, assessment, anything that you notice during your assessment that is not normal, you want to definitely write that down, so when you go back to chart your assessment, you know, okay, this person is missing a toe. Okay, this person's lung sounds are diminished. They have bronchi. They, you know, they're wheezing. You know, anything you find that's not normal, you definitely want to write that down. It's very important. So meds. A lot of the people on the floor that I work on don't take a lot of meds, but there are floors where people, because I work in an adult hospital, I don't work in peds, so older geriatric patients, they normally do take a lot of meds, especially the ones that were sent from the nursing home. Now, when they come into the hospital, they do cut those long med lists for patients down. They cut them down, make them shorter, and just only give them what they feel they really need in the hospital. But still, some people get a lot of meds, so you definitely want to take time to write them down and write down what time they get them. Pain is very important. You want to know if your patient is having any type of pain, because you definitely want to handle pain. Pain is something, when you go to nursing school, if you haven't already, they will tell you that's like the #1 thing. You do not want to let anybody continue to sit in pain. Vital signs, any labs, so like here on this one it's listed BMP, PT-INR, troponin, phosphate, magnesium. You definitely want to make sure you check their potassium, white blood cells, red blood cells, those types of labs. Skin and dressings. Do they have any issues with their skin? Do they have any dressings over those issues with their skin? When are the dressing changes due? Because some dressing changes are Q shift, some changes are Q day, Some changes are done specifically by wound care. Some dressings have to be changed all the time because they're on the patient's bottom, and when they soil themselves, it gets really poopy down there, and regardless of how often it's supposed to be changed, you got to do that thing PRN because you don't want poop in a wound, of course. Output, are they on strict I's and O's? How much have they urinated? You want to make sure on all your patients you're charting that they have urinated at least on your shift, because if somebody goes a whole shift without urinating, that's a problem. You want to bladder scan them, you might want to cath them, you just want to find out what the problem is. Their diet, are they regular diet, cardiac diet, consistent carb diet due to diabetes? You want to know that, are they on oxygen? Now, I currently work on a pulmonary floor. I will be switching to a cardiac floor, as I said before, but O2 is very important, and not just the O2 that they're on now, but their home oxygen, because you want to know what you're trying to wean that person down to. And if somebody's on 5 liters now or 12 liters high flow, and all of a sudden, and at home they're on room air, that's something you definitely want to know, because you want to try to start weaning them down to get to at least their baseline. Finger sticks now, and then we also have a little box here for Glucomander, because in my hospital we don't always use a sliding scale. Some diabetics have a sliding scale. Most diabetics, we use a computer system called Glucomander, where we put our blood gases into it, our blood sugars into the program, and it tells us how much insulin we're supposed to deliver to that, administer to that patient. No one really likes Glucomander. Anybody out there that's like a nursing information systems major, please find a way to make Glucomander better for the nurses, because nobody really likes it. We have telemetry and continuous pulse ox, which is very important. You not only want to know if they're on telemetry, but write their telemetry box down. Do not copy the last person, because sometimes telemetry boxes get changed, and it's very often that I find that nurses will continue to chart the old telemetry box instead of the one that has been changed to. So check your telemetry boxes. Your continuous pulse oxes, you want to check and see if they're supposed to be on continuous pulse ox. The care plan, what is it exactly that you're trying to do for that person that day? And that's all that's on this particular brain. To be honest, after looking at this brain, I probably need to use this one more often. I actually use the one that's given to me on the floor, because that one allows us, you know, it's just as good as this one, honestly, but it's just this one allows me more space to write, I guess, because the one that we usually use on the floor is like landscape, and this one is vertical. So anyways, so that was tip number 3. Get you a brain that tells you everything you need to know about your patient. Now, I understand that some nurses will be in the emergency room, and there's no way to create a brain, because the people that you get change not even just daily, but they change hourly. They change by the minute, you know, it's the emergency room. So I'm sorry I don't have any tips for you guys, because I haven't ever worked in the emergency room. However, for my floor nurses, my med-surg nurses, ICU nurses too, make sure you got a bomb-ass brain, okay? We need to know what's going on with these people. So my next tip, my number 4 tip, would be to have a beginning of the shift routine. Like I said, I work day shift, so my routine, since I don't get to work very early, is to make sure I put all my stuff in my locker, put my stuff down, put my coffee and my water where I need for it to be, so I can reach and grab it, because I drink a lot of coffee, I drink a lot of water during the day. I get that out, put my bag in the locker room, and I get report. After I get report, I sit down. That's when I look at my nursing orders. That's when I look at my labs that may be off. I look and see if anybody's on any type of continuous IV. That's when I just really get down and make sure I know my patients. I don't take a very long time doing it, but that's where I kind of just fill in my brain if I didn't already fill in everything from what I got in report. And then I kind of just double check and make sure the my code status that I got from in report is correct. If I got one, make sure I know my diagnosis if I didn't get that in report, and just kind of just check, you know, to make sure that there's nothing dire or any critical labs that need to be reported ASAP. And then after I do that, I make a quick round. I go into each of my rooms. Lately we've been having 5 patients apiece. I go into each of my 5 rooms. I write my name and my phone number. At work we have phones, Volt phones that they give us, and we have a phone number that's the same regardless of what floor we're on. and I write my name, my phone number. If I know who my CNA is at that moment, I write my CNA's name on our whiteboards in the room, so my patient and my patient's family know how to get in contact with us. And then I introduce myself to my patient if they're awake, and I ask them if they're in any pain. So that would be my number 5 tip. Make your morning round, and during that morning round, ask if your patients are in any pain, if they're having any nausea, anything that would prompt you to have to get a PRN drug. Because once you make your round and you come back and you start doing and you prioritize and you're getting ready to do your medication administration for that morning, nothing stinks more than going into that room, starting to scan your medications, and your patient tell you, oh, I need something because my stomach is hurting. Then you have to turn around, go out of the room, go back to the Pyxis. Don't let anybody be using the Pyxis, because then you gotta wait for them to pull their meds, and then you have to get a pain pill or nausea, vomiting medicine, whatever they need, and then go back to the room and start over. So during your take a walk through, find out what your patients need, so you know to go ahead and pull those PRN meds, and you'll have them before you start your medication administration. My next tip would be to prioritize. Now, this is hard, especially because as nurses, we're kind of taught to be very task oriented. Okay, you have to administer your medications, you have to do your dressing changes, you have to make sure that the IV lines are flushing and still working. You have to complete these tasks, but in which order do you need to complete them in? But really, prioritizing should have been right at the top of the list, because when you sit down in the morning, you want to know who to go see first. You want to know who your sickest patient is. You want to know who needs your attention the most. And again, prioritizing is not something that I'm amazing at. Prioritizing comes with, just like critical thinking, it comes with time. You'll kind of learn these things, but you do want to take time to prioritize your day and prioritize your patients. So my next tip, I don't even remember what number I'm on anymore, but anyways, my next tip would be to know yourself as a nurse. And when I say know yourself, know your personality, but also know your needs. For example, I told you earlier, I'm a coffee drinker and I'm not a morning person, but I did choose days, you know, due to my daughter having school. At least we thought they were going back to school before COVID happened. And so me not being a morning person and me working day shift or having to be there at 6:45 in the morning, I know I need coffee, and I know that I better have a sip of coffee before I get my day started, because I need something to burst my energy in the morning. I need that wake up call in the morning. So, and I know that about myself, and I'm okay with that being me. So, you know, and I also know what type of personalities I click with, and I also know what type of personalities make me very irritable. And I'm able to kind of you can't really avoid those types of people that you don't really care for, or you don't really, you know, your personalities just don't mesh well with people, but you kind of know how to handle them and where to put them while you're working together. But you need to know yourself as a nurse, period, because you also need to know, today I need a mental health day, today I'm not going to be a great nurse because I'm not feeling well myself. So how can I take care of somebody else if I'm not feeling good myself? So my next tip would be to know yourself as a nurse. So my next tip would be to know your resources. Know what nurses are your veterans. Excuse me, y'all, my hair piece is coming up here. Know what nurses are your veterans. Know what nurses have been working on the floor for a long time. If you have any questions, know the ones that don't mind helping. Know the nurses that can answer all your questions. Know your nurse managers. Know your assistant nurse managers. Know your computer software, or know where to find the answer. Know that if you don't know, I said no like a million times. Know that if you don't have the answer or you don't know where to go, know where to go find the answer. Example, all of our protocols, everything, all of our rules can be found on something called iLearn. where you can watch a video or you can read up on an algorithm. Any question you have, you can definitely go to iLearn and find out the answer. I'm one of those people, I don't really like to bother people because I understand that we're all busy, but I do know who to ask a question to, who won't mind asking a question to, and where I can go on iLearn to find the answer if I'm not in a rush and I have time to sit down and read about it. So know your resources. My next tip would be to take classes. You know, as a part of the nursing residency that I'm a part of, we have to take a lot of classes. We have to take classes on IVs. We have to take classes on medication. We have to take classes on delegation. We had to take a class on glucose, blood sugars, how to work Glucomander. As a nurse resident, you will already have to take every class to make you or to help you really know what you need to know. But sometimes a lot of nurses who just get hired onto a floor, they go through a few days of training or a few weeks of training with a trainer, and they're not obligated to take the classes that are offered through the hospital. But if your hospital has a lot of classes, like wound care, I had to take a wound care class not too long ago, and that was an amazing class. Like, I really enjoyed that class. So if you're not forced, or you're not required, excuse me, I don't want to say forced, if you're not required to take classes, go the extra step and take those classes, because they are very, very helpful. You get a lot of knowledge from those classes. And my next tip would be to keep your training, keep your CPR, keep your nursing license, keep everything that has an expiration date, keep it up to date. And let me tell you, I had my CPR license, it was due to expire in September. Everybody knows that CPR licenses end the last day of the month. And I waited to the last minute to get my CPR renewed, and I had to pay out of pocket for a CPR renewal class because the classes that my hospital offered ended up not fitting into my schedule. And for me to take a class that fit into my schedule, I had to go off site and I had to pay for it. Don't be like me. Be better than me. You know, keep your licenses and your certifications, everything you need, keep them up to date. And my last tip, I'm just gonna throw this in as like a bonus tip. Get you a decent clipboard. This is the clipboard. Sorry, y'all. I use this clipboard. It's a great clipboard. Get you a decent clipboard. It opens up. It allows me to store stuff in it. A lot of people I see have the foldable clipboards because they fit into their pocket. Everybody though has a good clipboard and a good nursing bag. I don't have a good nursing bag yet. Anybody want to donate one or buy me one off of Amazon, I'm so welcome to gifts. But everybody has a great clipboard, so make sure you get a good clipboard. So my name is Lanice, and that's all I got for you. I have been recording too long, so again, my camera shut off. But my name is Lanice, and again, I'm a nurse, and I'm here to deliver all the nursing information that I get to you guys. I'm also here to deliver a little bit of mental health. I'm here to deliver some lifestyle videos, and I hope that I've been very helpful. Anybody have any questions or anything that you want me to deliver through YouTube videos, please comment down below. I promise I will try my hardest to answer any of your questions, but just know, again, like I said, I am a new nurse. I'm just teaching you what I'm learning, and that's just the best that I can do. But if you like my videos, if you like me, please be kind and subscribe. Once you hit subscribe, please hit that bell notification so you'll be notified whenever I post new videos. And once you do that, share it with your friends, share it with your nursing friends, share it with your nursing mama, share it with your nursing sister, whoever you know who's a nurse or interested in nursing. Share it with them because they may enjoy it too. Sharing is caring, okay? So anyways, again, my name is Lanice, and I'm out.